Wells score is a validated clinical decision tool used to estimate the pretest probability of pulmonary embolism, PE. It helps guide the need for further diagnostic testing like D-dimer or imaging studies, e.g., CT pulmonary angiography. Original Wells score categories. High probability, 6 points. Moderate probability, 2 to 6 points. Low probability, 2 points. Two-tier categories. Wells total score, greater than 4.5 PE is likely. A range for imaging, e.g., CT pulmonary angiography. Anticoagulate if no contraindications and delay more than 4 hours. Wells total score, less than 4.5 PE is unlikely, less than 15%. Consider D-dimer testing to rule out PE. Apply PERC rule. Example, apply the Wells score for PE. A 45-year-old patient presents with dyspnea, leg swelling, and tachycardia, HR 110 BPM. Clinical signs of DVT, 3 points. Heart rate greater than 100 BPM, 1.5 points. Total, 4.5 points. Interpretation, PE likely proceed with CT pulmonary angiography.
The mnemonic had clots for the PERC rule. PERC rule stands for Pulmonary Embolism Rule-Out Criteria Rule. Mnemonic. PERC criterion. The patient must have none of these. Hormone use. Is the patient taking exogenous estrogen, e.g., birth control pills, hormone replacement therapy? Age greater than 50. Is the patient 50 years old or older? DVT/PE history. Does the patient have a prior history of deep vein thrombosis or pulmonary embolism? Coughing blood. Does the patient have hemoptysis? Leg swelling. Does the patient have unilateral leg swelling, a clinical sign of DVT? O2 sats less than 95%. Is the patient's oxygen saturation on room air less than 95%? Tachycardia. Is the patient's heart rate 100 beats per minute or greater? Surgery/trauma. Has the patient had surgery or trauma requiring hospitalization within the past 4 weeks? Clinical note. It is crucial that the PERC rule is only applied to patients who are already considered low risk for a PE based on a clinician's clinical judgment or another tool like the Wells criteria. If any one of the had clots criteria is present, the patient is not PERC negative, and this rule alone cannot be used to rule out a PE. If the Wells score indicates low probability, less than or equal to 4 points, and the PERC rule criteria are met, PE can be ruled out without further testing.